This is the Ladies Edition podcast by real women, where we discuss the adversity and absolute foolishness that comes with women's reproductive issues. It is the mission of the Ladies Edition podcast to inspire, educate, and shine a light on and in our V Valley while empowering women everywhere. Welcome back to the Ladies Edition podcast. I am one of your hosts, Shamika, and I also host and created Check the Rhymes TV, which you can find me on YouTube, sweet929.tv, and the Zonify app. Just go under the expression tab. And then you can also check out the blog, themofochronicles.com. And hi to my co-host.
Hey, girl. Look at you fancy today.
Check the rhymes here.
Oh, Lord. I'm Shelly Cheyenne. I am a podcaster with my own podcast, Chit Chat with Shelly Cheyenne, a author, and I have my coaching business, Coaching by Shelly. And you can find me on all the social media pages to learn more about my stuff that I do. And we have a special guest today. I have been so excited to talk about menopause for the past 3 months. I've been waiting. I follow her on her TikTok account, and this is Dr. Ashley Alexis. She is a licensed naturopathic medical doctor. She is the owner of Golden Leaf Health Center in Vista, California, where she practices natural therapies for hormonal balance and imbalance, the treatment of all of those type of things, different things that we're going to get into. She's going to tell you all about what she does. Follow her. Now, we're going to give her information later at the end of the show, but I want y'all to follow her on TikTok at the Menopause Doctor. That's Menopause and Doctor spelled out. It's amazing information. And I was so overwhelmed with the information and just seeing representation. I think that was very big for me because all of the other doctors on TikTok, not to take away, but I wanted to see someone that represented me, that looked like me, that probably heard all of the things that we're going to talk about today with her about minority women and how some of us we aren't told the same stuff. We're not given that information. So we're honored to have you here today, Dr. Alexis. And we look forward to this interesting conversation, this discussion today.
Yeah, thank you so much for having me. I mean, this topic is not discussed enough. So I'm really happy to, kind of either inform women that don't know much about it or to validate women that, may be feeling certain things right now and that don't know where to go or, who to see. So I'm really happy to be here.
Well, tell us a little bit about your background, how you got into this particular specialty.
Yeah, so as a naturopathic medical doctor, I have an extra set of skills that most conventional doctors may not have. As part of our 4-year medical training in med school, we learn everything that any other doctor in this country will learn, or any other med student will learn. We also learn nutrition, we also learn physical medicine, and we also learn how to incorporate the body as a whole versus just subsections and all of that. So that's what really drew me to the medicine initially, and finding the root cause of disease versus just treating symptoms. So when I graduated and was finally into practice, I was just general, treating anyone that I could, but I kept getting this influx of women in their earlier to mid 40s and older that were having these crazy symptoms that no doctor knew what to do with. And they had just been, run around from this medical practitioner to another and were offered maybe antidepressants or told to just lose weight and sleep better and not really getting the support that they needed. So I really dove into that and found that there was such a big need for women in perimenopause and menopause, even before, as they're transitioning into this time of life. And our information that, most doctors have is outdated. And there's a lot of fear around treatments for menopause. So that's when I decided to make it my focus. And now that's primarily what I do in my practice.
Awesome. That's
what are the typical symptoms of menopause? Because I know, like, both Shelly and I had hysterectomies, whereas she didn't experience any hot flashes, but I was sitting here with my head in the freezer from hot flashes. But that was just, but we both kept our ovaries. So, we're not really sure, like, so moving forward, what will those symptoms look like?
Yeah. And so keep in mind, these symptoms can start in our late 30s. So even before perimenopause, in premenopause, these symptoms can start. And so typically women will notice they're a lot more fatigued, a little bit more brain fog, hard time concentrating or just remembering things, or walk into a room and just not know why they're there. And then you have weight gain and issues with sleep. Very, very common. And maybe things like joint pain, hair loss. And then we talk about low libido, or vaginal dryness that may make sex very painful and uncomfortable. So these are a lot of the common symptoms, but there's, up to like 100 different symptoms that aren't, common, like dry eyes, so many little things can come through, and not to mention the hot flashes, and the cold chills, the night sweats, things like that. So they're very common symptoms that can start from the fluctuating or declining hormones that happen at that time.
Oh, Jesus. I'm like, half of the things you named, I'm like, yep.
I'm like checking off the checklist. I was like, well, shoot, but this is the thing. I experienced a lot of those things in my mid-20s. So, I kind of always been a night sweater. I have literally the AC on 69 and the overhead fan, ceiling fan. And I've been kind of that way since I was in my 20s. So are there different stages? I know there's perimenopause, and then there's once you get into menopause, but is there something that happens in between that time, or can you get like a combination of all of them at the same time, or, what are the stages?
Yeah, so we essentially say there's pre-menopause, before, those hormonal changes start to occur, perimenopause, which on average can happen on, around age 44, 45, can happen sooner. And then menopause, where, it's 12 months with zero bleeding, you're officially in menopause, and then immediately put into postmenopause. So those are the stages, but there's varying degrees of, women's ages at that time that they start. Some women in their 20s have early menopause or premature ovarian insufficiency. But if you're in premenopause and you're starting to have those symptoms, there's so many factors. One, environmental exposure. There's a lot of, xenoestrogens from chemicals, from our skincare products, from the food that we eat, the air that we breathe, that can mess with our hormone production. And so that can really impact how much estrogen we're making, if we're ovulating, how much progesterone we're making. And so those symptoms can definitely occur at that time. If there's no, medical diagnosis that's affecting a pre-menopause patient, like thyroid issues, autoimmune issues, premature ovarian insufficiency, PCOS, fibroids, all these different conditions that can affect how we feel, then we really want to optimize things at that time, focus on lifestyle, diet, exercise, stress management, and maybe choose certain nutrients and herbs to help with normal hormone production.
Wow.
Yeah,
a lot of our listeners also may have just had a hysterectomy, just like we did. So how will we know what, and just saying whether they kept their ovaries or not, will it still look the same, or, the symptoms still kind of be similar, or how does that work?
Right. So if you did not have an oophorectomy, meaning one or both ovaries are in place and just the uterus, cervix, and possibly fallopian tubes are removed, you still will be cycling. Your ovaries are still having that hormone production because they're not removed. So a lot of women that may have hysterectomy may not need hormones or have any symptoms in the first few months to a year after the hysterectomy. Now studies are showing that after the removal of the uterus, you may be put into menopause a lot sooner. And there's different theories as to why, maybe less blood flow, things like that. But if you still have your ovaries in place, you're most likely still making hormones, but they will start to decline in production a lot sooner than a woman who didn't have a hysterectomy, if that makes sense. If you had the oophorectomy, where the ovaries were removed, then that immediately puts you into menopause, whether you have your uterus or not.
And is that considered surgical menopause?
Yes. Yep, absolutely.
Okay, so that's where I think I was confused, because Shamika and I are part of this Facebook group that talks about hysterectomies, and it's really a good group. It's all these different women.
I'm not in the group anymore. They kicked me out.
She got kicked out.
Oh no!
But
we'll talk chronicles for you.
She got kicked out. But when I saw surgical menopause and just that that unclear. A lot of the women on there, they're unclear. They don't know what's going on. Their doctors aren't talking to them. And so when they said, oh yeah, well, you're in menopause, surgical menopause, as soon as you have a hysterectomy. And I was like, oh my God, maybe that's what's going on with me, because now I'm wondering, is that what it is? But I'm so glad you clarified that. So even with those of us that have kept their ovaries, we're still producing hormones.
Yes.
We still are going through the whole PMS process pretty much, except we just don't have a cycle.
Correct. Yep, absolutely.
You know, that's unfair. I know you don't have nothing to do with that. Okay. But that's unfair. Like, isn't that confusing the body in some kind of way?
I always think that, if you're still naturally producing your hormones, it's better than not, and this will fall in the same category with women who had uterine ablations, where they just cauterize the uterine lining so they're not having a period. And so then you don't know where they are in their cycle either. So it's that same type of idea with, not knowing what your body's doing, but you still have your ovaries. They're still making the estrogen and progesterone that are so protective for women. The benefits of those hormones are what keep us young, what keep us, fertile if we're having children, but protects our hearts, our brains, and our bones, which are 3 areas of concerns in menopause for women who have increased risk for cardiovascular disease, osteoporosis, and dementia. And so you're still having those hormones in your body. You want those hormones. So even though, women are happy not having a cycle anymore and having a period, dealing with all of that, it's good that you still have your ovaries if you are able to.
Okay, so I guess I should be glad about that then. But still.
That brings me to just a question that just came to mind, because one of the reasons that I decided to go ahead with the hysterectomy was because my doctor told me that I could still retrieve my eggs since I was keeping the ovaries. And so is that true? Because there were people that said they'd never heard of that and didn't know. And I was like, well, why would he lie? I mean, I'm not going to pursue that, but I just wondered if that is something that you can actually do.
Absolutely. Yeah. You still have those follicles present. How long they're going to be viable after hysterectomy is the question. So as soon as possible for retrieval would be, ideal because of that, decline in hormone production that occurs much sooner once the uterus is removed. So it's still potentially a possibility.
Oh, okay. Okay.
Yeah, absolutely.
See, now that answers that, because we were trying to figure out how do y'all go, how do you even do that, to go back into something that has been closed basically, and and you retreat. It just all seems like it's too much for your body to go through. Even that, after you had a hysterectomy, that in itself is enough.
A lot.
But, to now have to do that. But like Shamika said, it was another question that we always get. Yeah. And we needed clarification about that. But when a woman is in, let's say, perimenopause, are there any treatments? Should she start treatments, any kind of medications or anything, even natural, whatever? Should she start something early on, or should she wait until she's in post-menopause?
So I'll start by defining how if you're in perimenopause or not, and just, ideally what that means on average. So, or what that looks like. So on average, we say it starts around 44, 45, but it can happen sooner or later. What typically happens first is changes in how she feels. The symptoms that I mentioned: she's not sleeping, she doesn't want to have sex anymore, she's gaining weight. The dietary and exercise things that she was doing before are no longer working now, right? And she may have hot flashes, may have night sweats. So those are early signs that there's hormonal changes occurring. And then the next sign is menstrual cycles. So maybe her menstrual cycles are becoming more frequent, where she's having, let's say, 2 bleeds in a month, or she's starting to skip months in between her cycles or menstruation. So those are often the early indications that she's in perimenopause. Now, if it's really early on, I would say this for anyone, really honing in on lifestyle determinants of health. Diet, exercise, and stress management are key. And I find in my practice that women who had, really been intentional about making those healthy choices throughout her life have a little bit of an easier experience in the transition into menopause. And when I talk about stress a lot, our adrenal glands, which are, two glands that sit on top of our kidneys, produce our stress hormones. And so as our ovaries reduce production in our sex hormones, in menopause and a little bit before, our adrenals will take over. And it's because they still produce a little bit of hormones on top of managing cortisol and other stress hormones. And so if there's been chronic stress, and a lot of other issues there, that could really, that amplifies the experience in menopause and perimenopause. So I would say start foundationally, make sure all of those areas are being addressed. And perimenopause, menopause is really a time for women to check in for themselves. We spend a lot of time giving and pouring out and doing for others and raising our families and workings and wearing all the hat. Not a lot of us will, take care of ourselves. So it is a time now to start doing that, because if you continue this, you're going to run out of gas really fast. So it's a really good time to check in and start with all of that. And then treatment. So, often those typical menopausal symptoms are indication of low estrogen. So we want to do things to optimize estrogen, and we can either supplement with hormone replacement, or really work on diet, because that also, and with healthy fats and cholesterol are what feed and make our hormones. So we need that. And then optimizing ovulation and progesterone production, and there's seed cycling, and then there's things like black cohosh, fatty acids that are really helpful for overall. So you can start there. Some of my perimenopausal patients, I'll give a little bit of estrogen in the beginning of the cycle to help boost their production there. So it's really nuanced. There's not one option or one way to do things in perimenopause. That's why I always say it's never too early to start working with a hormone specialist or a menopause doctor, so that we can get things going in the beginning stages before things really get, become worse and intolerable and really start to affect your quality of life eventually.
But we don't know to do that.
Exactly.
I thought my gynecologist, that's who, she knows everything. She's supposed to know this part, right? She's supposed to take me through this this next phase of my life, and then she don't know. So it's like you don't know until you start talking to other women, or you start seeing different things and you see these different specialties, and you're like, there's a whole doctor for this. Wait a minute. So that's why I'm so glad that we have this podcast to just bring all of this awareness out, that the earlier you can start getting into, like you're saying, talking to other doctors, other people that specialize in certain things, because women are very complex, as obviously, and so we need a little bit more hand holding. We need a little bit more zhuzhing and just, things that we need to focus on outside of just going to our primary care or going to our gynecologist. We need to really hone in on different specialties. So I'm glad you pointed that out.
And to your point that your OB gynecologist should know what to do in this time of life. That's their focus. Actually, their focus is giving birth. Their focus is, vaginal issues and conditions, things like that. And so they're not specifically trained. And I've heard this from numerous OBs. I've heard this from numerous patients over the years that I've worked with, that they're not trained in how to manage perimenopause and menopause. Unless you find a gem, a unicorn, there are doctors out there that, know hormone replacement or know natural things to help a woman, treat this time in perimenopause. But a lot of them don't. And so what's a detriment to women is when they tell them it's in your head, you're just depressed, and they don't know to go anywhere else, that there's other options out there. So that's important. So, I would say always be an advocate for your own health. If your doctor is not serving you in the ways that you need, find another doctor out there to do so.
Yes,
Absolutely.
that is so important. And I'm glad you mentioned that about some of them just don't know. I recently went to my gynecologist, and I asked her, can you please check my hormones? I think something is off.
Yeah.
She checked my thyroid, and that was it. And I was like, that's it? Where's the rest of it? I didn't even know you were supposed to get a whole panel, or are you supposed to get a panel? I had no idea. What are you supposed to get checked? And who do you go to? I didn't know. So I'm clueless.
it's a very common, experience that women have, and doctors, they'll test things that they know how to treat. And so if she tests your estrogen, progesterone, testosterone, but then doesn't have an option for you when the results come back, they're very limited in that way. And I'm not saying that they're not effective practitioners and doctors. They're really knowledgeable in what they do. But, it's just good to work with someone who knows specifically how to treat women in that time of life. So absolutely.
There are a lot of, I have a girlfriend of mine who, she and I had this conversation, and she said, Shell, you really need to see an integrated medicine or someone else, because she just explained it to me. She said, because we take it a step further where she's my go-to person, because I'm like, what's wrong? My hair's coming out. And that was my first sign that something is not right. I have a lot of thick hair. It may look thick now, which I think is why doctors don't pay me no mind, but your hair. And it was coming out like I couldn't do this. And I have a whole bunch in my hand. And I remember telling her, and I said, I got sheets and sheet work of blood tests that my doctor kept doing, my primary care. And she's saying, you're fine. I had a thyroid scan. Everything's fine. She asked me, she said, Shelly, are they looking at the range? Because we want you to look at we want to look at the optimal range. And see, it's stuff like that we don't know. And like you said, when you go to these doctors, they just tell you, oh, you are 47. Girl, my mother didn't have menopause, so it's like, okay, okay, I'm 47. Now what? Am I in peri? Am I in, this? And they run tests for that. Everything starts with the blood work. So it's like, if you're looking at blood work to test things or to see if I'm in perimenopause or full menopause or whatever, then if the tests aren't saying that I am, then what is actually going on? Because we know that it's something hormonally. And, I didn't know to talk to anybody other than my primary care or my OBGYN. That was it. Yeah. So when people come to you, first of all, how do they find you? How do they know to seek you out? And what happens when they come to you? What are some of the steps that you take to figure out what's going on with them?
Yeah, absolutely. So one of the big ways, about 5 years in practice, word of mouth. I've worked with enough women now. It's like when we find something good, we want to share it. So that's been, how people find me. Number 2, social media. I'm very active online. It's just a great way to get a lot of information out there. And so I'm just in this education mode, just talking about it, letting people know that there are options out there. I've had husbands of wives who found me online, who then referred their wife to me. So, however it works, as long as women know there's an option out there. And then, word of mouth and social media are the biggest avenues. And so when they come to see me, I always get a baseline of labs. And I'm not looking at only sex hormones, estrogen, progesterone, testosterone, DHEA, and then some of the brain hormones like FSH and LH. I'm also looking at a full thyroid panel, not just a TSH and maybe a free T4. I want to know your antibodies. I want to know all your thyroid hormone production. I'm looking at a full cardiovascular panel, since heart disease is the #1 killer for women, especially women of color. I want to see exactly what's going on there. What is your lipid profile? Are there any inflammatory markers that are elevated? And any risk for like coronary artery disease. Sometimes we'll do a CT imaging scan where we'll look at, the calcium score of your arteries for any potential plaquing. And then, basics, looking at your liver and your kidney function and your red blood cells and all of that. So I do a comprehensive view of everything to get a baseline. And then we figure out, if she's in perimenopause, what's going to be the best plan of action for her. Is her FSH, which is follicle stimulating hormone, and luteinizing hormone, if they're elevated over 25, you're most likely going to be in menopause soon. If she's still cycling. Like, okay, we're gauging that. It may be a good time to start hormone replacement. If she's not close, if her FSH and LH are low, I'm like, okay, you're still menstruating regularly. Let's see how we can optimize how you're feeling. And that will be with some really digging into lifestyle stuff that I mentioned before, doing some counseling there. If you need a little bit of estrogen, I might bring that in, but I mainly want to optimize how she's feeling and all of that. And that reminds me of a point I was talking to someone about. In our conventional medicine, when you're talking to your internal doctors, your OBGYNs, they're trained to treat disease, okay? Menopause and perimenopause are not diseases. What they lack in is optimizing wellness. And so that's always my goal with my patients, is to optimize wellness and then see what interventions we can bring in after that. So that's the experience that my patients have. We always start with lab testing and then create a plan that may include hormones, but will always include some type of, lifestyle support, dietary support, exercise, all of that, and then maybe some nutritional supplementation or herbal medicine to support whatever we're trying to do.
Oh my gosh. I need to come out there.
It's an experience.
It sounds like an experience. I just need a full everything. Just give it all to me. I need it all.
Do you take virtual patients? Do you do like virtual visits?
Yes. So if you're in California, I could medically treat and advise and do a workup for you. Outside of California, if you're a resident and you're not able to come see me, I do offer non-medical consultations where I can look at your case, answer questions, provide some guidance. That's my way of still being able to help, without being your doctor. So yeah, definitely.
Okay. Well, which brings me to my next question. What are some natural remedies for women that are going through menopause? Like, I have one friend that she sent me a picture of something called Fibro Defense. I don't know, she got it at a health store or something, but while she had fibroids, I guess 1 or 2 that she just discovered, but she's in menopause. So she said taking that while she's not having a cycle right now, she said taking that she thinks helps shrink the fibroids, but it also helps with her hot flashes and whatever other symptoms she had going on. And I was like, I've never even heard of that. But, there's some other things that she's been taking from different health stores. So are there any other natural remedies? Because I don't know what's in that or what it is, but it's working for her.
Yeah, there's a lot of products out there that women do very well with. So in menopause, when you're no longer cycling, your hormone production is very extremely low. Some people will say, oh, well, let's try to balance your hormones. Well, I say there's no hormones to balance. It's just like, we have to bring hormones in at that time. However, like I said, to optimize certain things, there are nutrients. I'm assuming in that Fibro Defense product, I'm not sure what's in it. When it comes to fibroids, it's an indication that there's an estrogen metabolism issue. Mm-hmm. So women have a hard time breaking down the estrogen that they're making and are not able to clear it out. So then it recirculates, adds to the incoming estrogen for the next month. And estrogen is very stimulating. It grows tissue. So it will grow the fibroid if you're not clearing it out. So I'm assuming she had something like DIM in her products, calcium D-glucarate, some methyl B vitamins, things that help to clear out estrogen. So there are things like that out there that, could really decrease some conditions and improve some things. There are products like black cohosh or rhubarb that help with hot flashes for some women and not all. And so, I've seen everything. My patients come to me having tried so many things. And what I find is that those things will work for a certain amount of time and then not work. And I'm talking specifically in menopause. And so that's when we talk about hormone replacement therapy. So naturally, getting a good multivitamin in, my staples are multivitamin, fish oil, good probiotic. And then, of course, if you have low vitamin D, if you have low B vitamins, then incorporate those as well. But there are a lot of menopause formulas, hormone formulas out there that women can do well with initially. And like I said, it all depends on how you took care of yourself leading up to that point. But then discussion for hormone replacement therapy is something that I talk a lot about with my patients because of the benefits, because of the longevity protection and improving quality of life. So,
have you ever heard of using green clay? Because we had a guest that was saying that she was able to shrink her fibroids by, I think she said she drank green clay.
No, I think it has a lot of detox support. I don't have experience with it, but I can see how that could be a potential. I just don't know much about it, but that's awesome. It's amazing. Our bodies are amazing. There are so many things out there that will work for, certain people. So that's great that you got some relief.
Mm-hmm.
Absolutely.
Can we see or use our mothers as an indication of when we will go into menopause? Because my mom has passed, but I remember her saying she entered, I guess, about 52, 53. She doesn't recall having hot flashes, like major hot flash. Like she said, when she entered menopause, she didn't have any issues up until then. She just went into it and didn't really have any major bad menopause, effects from everything. So I'm wondering, is that going to happen to me? Because I can't take what's happening right now. I mean, the weight gain itself is like sitting right around I look like the Ghostbusters doughboy on a Ghostbusters. Yes, I do. Which I ain't gonna stand up, Dr. Alexis. I ain't gonna stand up. So you don't. I'm not gonna do it. But it all is going to your midsection. I've never had a stomach. I've never had a waist, and it's all there. It's made up for it, And can I expect the same things that my mom went through? Is it hereditary? Like, what is your experience with that?
Yeah, I always ask that question in my intake. Do you know your mother's experience in menopause, your aunt's experience? Do you have older siblings? Because that can give an indication of what your experience is going to be like. Not exactly, but give us an idea of when to expect menopause to happen or occur, and also your experience through it. So, yeah, the problem is what I found in the older generation, they don't talk about it. So a lot of my patients don't know. And
why don't they want to talk about it?
It's taboo, it's shameful, the whole culture around menopause, really makes us feel unwanted at that age, not desired, not valuable to our society anymore. So women don't talk about it and they just suffer in silence, and that's a problem. Yeah. So if you're able to have that insight, that's a privilege. It's definitely important to know that.
Yeah, because I remember I had to pull it out of her.
Yeah.
And to say, well, mommy, when did you go? Well, I just, women, we just went through it. What does that mean? You just went through it. Like, did it go through it hard? Did you go? Because I don't remember her going through it. I was into my own stuff as a teen, but I'm like, I can't remember her doing fanning or feeling hot or even mentioning it. It was just like she said, she just went through it and then it was over. And that was it. I remember her talking about, oh, I'm so glad I ain't got to worry about that. I remember that. Yeah. But like you said, it's so taboo to just talk amongst other women and say, hey, did you experience that? Or even now, which is why this show, we wanted to have this podcast to talk about it. And Shamika and I talk about it all the time. She'll call me and say, hey, do you have this? And I'm like, girl, yes, here's that, Yeah. So just not being, and to me, it just makes you not even know your history, your family history. I didn't know I had fibroids. My mom said she didn't have fibroids, so she don't know where I got it. Turns out she had fibroids, we found out. And I'm like, so it's all these different things that we don't know unless we talk about it.
Yeah, my mom was the same way. She, she's like, I don't remember. I'm like, you do remember. You just don't want to tell me. Or, I'm like, give me something. Or she's the same way with the fibroids. I don't know where you got that from.
Yeah, there's, unfortunately, there's a disconnect, with women in our bodies. And, I, know that a lot of women don't even know what a menstrual cycle means and what's happening. So, if we're not really educated and taught that when we're young to really know what our body's rhythms are, then when we enter menopause, especially if there's no support, it's just like, okay, there's something I have to deal with. It's embarrassing to say that I'm dealing with hot flashes. It's embarrassing to say that I have vaginal dryness. Only 7% of women in this country report vaginal dryness, and the rest, just suffer. And it's because of that shame and embarrassment. So a lot of our older generations don't talk about it, or they're just trying to forget the experience, and move on. But
Well, how do you handle vaginal dryness? I keep asking Shelly and she don't have an answer for me.
Because I'm not experiencing that yet.
I need to know the answer for this.
I'm good. I'm good.
Sure. So estrogen is our body's natural moisturizer and lubricator for our hair, our nails, our skin, our joints, and our vaginas. And so as estrogen depletes, we'll experience vaginal dryness because there's no circulation to the vaginal tissue. So there are a lot of over-the-counter products that have like more moisturizing effects to just relieve vaginal dryness and maybe, help with intercourse. But that's not going to actually treat the issue. And so there are vaginal estrogens that can be prescribed where you apply vaginally, estrogen cream, for example. And like I have a loading dose for my patients the first 14 days every day, they'll apply this vaginal cream. And it actually brings circulation to the tissue and encourage natural lubrication. So that's an effective, treatment that I use. People also are given vaginal testosterone, vaginal DHEA. So it just depends on what the needs are. But I take care of a lot of that for my patients with the vaginal estriol cream, which is a form of estrogen, but a weaker form. So it's just localized to the vaginal tissue. So yeah, there are a lot of treatments out there. And then hormone replacement in general, bringing back estrogen, bringing back progesterone, and potentially testosterone too, can also promote that as well.
Okay.
Yeah, there are solutions. Don't suffer in silence. You don't have to, believe me. There are many couples that get divorced because they can't have sex, and libido is a whole nother issue. So, these are really serious symptoms that, people don't really take seriously because it's something you have to deal with. But it actually affects how you feel, how you view yourself, how you interact with people around you, your relationships, how you work, like everything. It's so deep for us. Hormones are so important. So yeah, don't suffer in silence.
Love it.
Well, I know we are, we always get asked a lot of questions, but we're not medical professionals, as we try to state on our show. We have no knowledge of medical, nothing. I actually am an educator, so I work in education. So we are far from being able to give women advice. But what advice would you give women who are entering these different stages of menopause and just the cycle of life and, what to expect? What advice would you give us?
Absolutely. So when I talk about this, I always get the comment or the thing like, well, I went through menopause and there was no issues with me. So everyone should just, I'm like, that's not everyone's experience. So my advice for women that are suffering in menopause and perimenopause, whether it's your daily quality of life, just, feeling miserable, not feeling yourself, find a hormone specialist or hormone doctor. If you happen to have an OBGYN or primary care doctor that's knowledgeable in this area, wonderful. But you need to find a specialist who knows what to do and how to help you, knows what to look for and how to treat. So, don't get discouraged or just take that one opinion from your primary care doctor if they're telling you it's just menopause is natural, therefore you just deal with it. Yes, it's natural, but you don't have to suffer. And so I would say that. And number two, really focus on your lifestyle and making those healthy habits, whether it's finding a nutritionist to work with, working with a personal trainer, going to therapy to help with any trauma and emotional issues, and dealing with anxiety. Those are all important. Really spend the time to invest in yourself. And, like I said, this is a time in life where you're supposed to stop and check in and put a pause on giving so much outwardly and make sure your cup is full so that you can continue to do what you do. And I would say the third thing is there's a lot of fear around hormone replacement therapy. There's a lot of misinformation about it. It gives you cancer, it'll do this, it'll give you a stroke. And those are absolutely not true. And these are blanket statements that are when hormones are very nuanced. It depends on the type of hormone, it depends how it's delivered. Is it synthetic? Is it non-synthetic? How long are you on it? What form? Did you take birth control prior? Like there's so many different factors. What's your genetic predisposition? What's your medical history? What's your family history? So there are blanket statements made about hormone therapy that are just absolutely not true. And so working with someone who is knowledgeable, knows the research, practices it, is going to be the best option to educating yourself on the direction to go. So yeah, that's what I would say for advice.
That's great advice. Absolutely. Especially the part about going to therapy and healing those traumas and all those things, because we've talked about that before on the show. And so, I do EFT tapping, I do therapy, anything to get all this trauma out. So
yeah, absolutely. Absolutely. Our bodies remember, things that we experience, our bodies will hold on to and manifest. So it should be a daily practice, especially for us women, to make sure that we are addressing those issues and taking care of ourselves.
Well, Dr. Alexis, we are so thankful, so grateful for you spending time with us today. Just taking us down this road of menopause and understanding it better, because now I know it. I get it now. I still don't like the fact that I have to enter it. I'm kind of nervous. I'm afraid. Because I'm starting to see little things, and I'm like, if this is happening now, I am nervous about it. But talking to you today makes me a little less fearful, because now I know that, I just need to get with a specialist now who can help guide me through it. And you shared enough information to me that I was going to ask you that about hormone replacement therapy, because that was a fear of mine. And I'm glad you pointed that out as well, because that's something that I hear a lot of women don't want to get on any kind of hormone replacement. So, but we just appreciate you spending your time today to talk to us, to talk to our listeners, and sharing all of the information with us. And tell us how we can find you, how everyone can find you.
Yeah, so appreciate that. My website is goldenleafhc.com. And you can find me on TikTok at Menopause Doctor, Instagram at NDAshley. And the phone number to my clinic, 760-542-8898. So those are the main ways that you can get a hold of me. And I offer free 10-minute consultations so that we can get on the phone and chat to see, how I can support you.
Well, we're going to leave that information on our Facebook page, as well as the podcast description for this episode. So you guys definitely check out Dr. Ashley Alexis. And we appreciate you for coming in and talking to us today.
Yes, thank you for
coming. It's super fun. Thank you so much for having me.
Thank you for tuning in to the Ladies Edition. Don't forget, subscribe to the podcast and tune in next time for more riveting conversation.